Good afternoon. It's Mayor Jerome Prince with the COVID-19 update for July 24th, 2020. As we know, the COVID-19 virus continues to be a public health challenge for the city of Gary. For the past week, we've continued to see double-digit increases in new positive cases. The surge in new cases follows an approximately 6-week period in which we saw single-digit increases. From the beginning of this crisis, I've repeatedly said that I will take all necessary steps to help protect our community. 1 week ago, I ordered that all Gary residents and visitors wear masks while in public indoor spaces. There are also exceptions to that order, such as workplaces where staff members can work while practicing good, safe social distancing techniques, such as being 6 feet apart and, of course, wearing masks. Recently, the Gary Common Council supported this mandate, and on Tuesday, they actually took the rare step of suspending its rules and passing an ordinance adding real enforcement teeth to the ordinance. This was a sign of support for the community, and to them, I thank each council member. As we move forward, I offer a few reminders. To our faith leaders, you must still practice good social distancing in houses of worship, which includes having only 250 attendees in your service, but they must be spaced apart. The family units and individuals must be placed 6 feet apart and wear face coverings indoors. They may remove their mask while in their spot during the services, but they must wear their face coverings at all other times. For businesses that have customers in public traffic, such as shops, hair salons, barber shops, your employees and customers must wear face coverings at all times, and all businesses must post face covering mandates on their entryways. The next category is a little bit more challenging, and that is our area beaches. One of our biggest challenges has been balancing our residents' needs for outdoor activity and recreation, along with the fact of keeping our people, our residents, safe from COVID-19 virus. My administration, by way of the Park Department, has come up with a temporary approach that we believe will satisfy both of these requirements. If our beachgoers comply with this mandate, then we should be able to keep our beaches open. If they do not comply with this mandate, then I am prepared, under the direction of the Health Department Commissioner, to close our beaches to protect our community. First, everyone entering our beach and parking lots, or our beach parking lots rather, must wear face coverings. If they do not have face coverings, they may purchase $1 face covering or face mask right at the point of entry. Anyone who refuses to wear a mask while entering or parking areas will be denied entry into our beaches. Also, you must wear your face coverings whenever you enter or exit the beach and when you're in common areas, such as restroom areas outside your specific 6-foot designated area, except when you're in the water. Next, every group entering our beach or parking area will be required to purchase a 6-foot paper tape measure for $2 each. The groups that use this shall separate their spots using the 6-foot designation, and this will absolutely determine their length or the area that they have established as their own. We strongly suggest that you mark your area by blankets or canopies or simply drawing a line in the sand to designate your spot. And again, it's important to note that when you leave your designated area or you are in common areas such as restrooms or at the restaurant, that you should wear a mask. Any person who leaves their group and returns to a common area must wear face coverings to re-enter the beach. At this particular time, I'd like to bring Dr. Walker up, who will share the most latest COVID numbers, in addition to giving a little bit more insight about the particular plan that we just explained. Dr. Walker.
Thank you, Mayor, for this opportunity. Thank you, citizens of Gary. I'm going to take a little bit different approach today, be a little bit more conversational, so we can give some perspective about what coronavirus is going to mean to us. I want you to start thinking of coronavirus like we think about polio, like we think about diphtheria, pertussis, where hopefully one day we have an effective vaccination. But this is a virus that's probably going to be around for the rest of your life, right? And we want to be able to control the virus so that we can go about our way of living that we've grown accustomed to. So under this pandemic condition, we're probably talking about not to the end of the year, like the first some of our national conversation was. We're talking about maybe several months, a year, maybe 2 years. So we want to do the things properly so that we can go back to our previous way of life in a responsible manner. So I'm going to share some sobering numbers with you now so you can kind of understand why we're taking an approach, and I want to talk to you about some of the things that we can do to get back to the way of living that we want to be. So in Indiana today, our new case numbers for the day is 1,011. Now that is the highest that I've seen in the last 8 weeks, and I have to check. That might be the new highest number in Indiana currently. So we have a total now of 60,598 with, unfortunately, 2,687 deaths. In Lake County now, we have a total of 6,526 cases with 260 deaths. Keeping an eye on Porter County again, whose numbers look very similar to Gary proper itself, in that Porter County had 21 new cases over the last 24 hours reported, and they now have 995 cases total. Now I want you guys to pay particular attention to these numbers so that we can understand that the steps that the mayor has put forth are really, really important. There are 15 new cases in Gary, Indiana over the last 24 hours reported. Now, when you think about that, our average now over the last 7 days is around 12 new cases a day, where we've seen a high of 20. And here's the sobering number now. We've now had 1,000 cases in the city of Gary, exactly 1,000, me being one of them, 1,000 cases in the city of Gary since this pandemic has begun. We had one new death, unfortunately, with 62 new deaths. We're also, our statistician, Martin Brown, pointed out to me, we need to start watching our death total again as we're increasing the death total more frequently. The Indiana strike team will be coming to Gary, Indiana for the next 2 weeks. So the most successful site we've had has been St. Timothy parking lot. So we will have for the next 2 weeks from Tuesday through Saturday drive-up testing in the parking lot of St. Timothy Community Church. It is the most centrally located testing site we've had. It is the largest parking lot that we've used. And so I'm inviting everybody who thinks that they may have been exposed, who wants to be tested. As I know right now, there's no limitations on who's being tested. So if you believe that you've been exposed, you can be tested at St. Timothy parking lot. I believe the hours, and hopefully I'm telling you correctly, is in between 9 a.m. and 6 p.m. Tuesday to Saturday for the next 2 weeks starting next Tuesday. There's a couple of things I wanted. So I've said this repeatedly. The citizens of Gary actually have done an excellent job wearing their face coverings, doing social distancing, but there's no Great Wall of Gary around Gary. So what happens nationally affects us, right? Our borders, people come across the border, so we have to be able to do things to protect ourselves accordingly. The beaches have been a particular point that we've really discussed and had intense conversations about. And as health commissioner, one of my roles may be to close the beaches. But in discussion, I have to tell you that the Parks Department came up with a very good plan, if implemented properly, to keep people social distancing. But we have to monitor that closely. So Gary, if you look at it in the South Shore, has the most square footage of any beach in the area. So you should be able to social distance properly. We want to give activities to the people, the citizens of Gary. We want to be able to, we don't want everybody just to feel like they're just cooped up in their house, because that can lead to some mental health implications too. But people have to be willing to follow these rules. And we wear masks not only to protect ourselves and to protect others, but to model behaviors so that other people around us are wearing their masks, so other people are social distancing. And If we're not able to do that, unfortunately, we'll have to shut down the beaches, which is something that nobody wants to do. So I'm begging, please, let's follow these rules, let's follow these mandates, and try our best to keep our beaches open. And there's other things we need to look at too. If you look nationally, at the behaviors, particularly of younger people, it's parties, it's clubs, it's beaches, it's bars, and then younger people are taking these viruses back to their families. So these are all things that are on the table that we have to look at to see, do we need to limit some things, and maybe some other things can be more wide open, as we see what the causes are bringing this, able to spread this virus. So, I'm hoping that we're having a dialogue amongst ourselves in the city and communicating of things that we can do to make our lives safer and better. And so I appreciate the opportunity to serve the citizens of Gary. Like I said, my office is always open to conversation because I know I don't have all the answers. I just know that we're trying to do our best for the citizens of Gary, and I appreciate you, and I appreciate your support. Thank you.
So thank you, Dr. Walker, for sharing that information. Thank you for your continued monitoring and guidance that you've provided from a medical perspective. I want to revisit the subject of beaches for just a second because, as Dr. Walker has suggested, it certainly has been a concern of many persons across the city, and there's varying perspectives. There are some who absolutely and emphatically want to enjoy the outdoor recreational opportunities, and then there's those who are rightfully concerned about the spread of the virus and how it may impact them, their loved ones, or just people in general. To that extent, Dr. Walker is absolutely right. First of all, to compare our beach with some of the other beaches that are adjacent to us that are closed is just simply not a fair comparison. We have the largest span or area span of beaches in Northwest Indiana, and to that extent, it provides us a unique opportunity to at least try something a little differently. The observations of staff is that people have been social distancing over the last couple of weeks, but the new plan that's been derived by the park department looks to offer additional enhancements to the opportunity to social distance. I personally think the plan's a pretty good one, and to that extent, we'll certainly continue to make those assessments, and if necessary, as Dr. Walker prescribed, he'll give us the order sometime at the beginning of the week or whenever it warrants to close down the beaches. I also want to say that we're looking at opportunities to restore other public recreational opportunities. The one that particularly comes to mind is one that's been the subject of controversy, or at least a subject of unsettlement for some, and that is the ability to exercise at our area basketball courts. And in many instances, those have been compared to the beaches. Well, again, it's not a fair comparison. Basketball, by its very nature, is a contact sport, and just from a perspective of responsibility, there is no way that the health commissioner or myself as mayor can sanction a basketball game. To that extent, we are open to considering additional or alternative ways in which we can restore outdoor activity to any recreational area in the city. But until that happens, and until we have a concrete plan, such as the one that was offered for the beach, we must act responsibly. And to that point, we would hope that everyone adheres to the request and the urging of the city administration and health commissioner to continue to practice the safest social distancing techniques that you possibly can. In closing, I just say that there's a lot to consider, and we all are in this fight together to try to eliminate the spread of the coronavirus. In City of Gary, we've had successes with many of our residents practicing social distancing, but in other cases, there's been people who are simply completely dismissive of any suggestion to social distance or to wear masks. And if you don't consider it important to yourself, I'd like for you to at least consider the potential to spread it to other folks. And we believe, as has been shown by the evidence, that if we implement certain procedures and practices, that we can slow down the spread of the virus. Those practices, again, include safe social distancing, 6 feet apart, and of course, wearing masks. We're going to continue to very closely monitor the situation at the beach, as I suggested, and I expect that sometime very early next week, we'll bring you another update and perhaps have to take more extreme measures or more restrictive measures to regulate the activity out there. That also includes activity of places like bars or restaurants, clubs, nail salons, or any places where people have to congregate. It's not our desire to disrupt the ordinary lives and the freedom of citizens. However, it is our responsibility to do what we feel is in the best interest of our citizens to keep the community at large open. And to that extent, I appreciate all the consideration that's given. I also appreciate the opposite opinions because they certainly give us reason to pause and to consider additional information or alternatives to keeping the community safe, but still providing opportunities for persons to enjoy the community at large. Once again, I thank you for your attention today. I certainly thank you for listening to the urgence of the Health Commissioner as well as the City Administration, and I wish you all well. In closing, I'll remind you that if we stay together and we not use opportunities that could be slightly controversial to pit ourselves against one another, we will get through this together. Thank you.